Welcome to our next lecture, and we have as our speaker Dr. David Lin, who is from Singapore. David, welcome, and we look forward to your lecture.
Hi.
We also have in the panel Dr. Jacob John from the University of Malaysia and Callum Durward from Phnom in Cambodia. So David, thank you for the lecture, and we look forward to you learning from you about your work in Singapore and also how you manage particularly fragile seniors and your experience in domiciliary care.
Good morning, everybody. Welcome to the Special Care Dentistry Lecture Series by the Global Child Dental Fund. My name is David. I'm a special care dentist based in Singapore. I work in an international humanitarian organization called the Citi Foundation. So I work in the dental office in Singapore. Other than that, I run the Special Oral Care Network, which seeks to tie together different health professionals to advocate for oral health for persons with special needs. So our lecture today will be about anxiety and cooperation management, pharmacological and non-pharmacological strategies. This topic itself has a special place in my heart because when we talk about patients with special needs, it's often the cooperation that first comes to mind. And knowing how to do this will definitely set you above the general dentist to be able to manage them. So before we get into the lecture proper, let's find out about each of you. So I may not be meeting any of you because this is a recorded lecture, but hopefully through the years we can amass a number of comments and to learn about one another. So if you'd like to whip up your phones, scan the QR code, and it'll bring you to this page. And in that first activity, tell us about yourself. You can write down your name or a nickname. Tell us where you're studying or where you have studied, and something cool or interesting about yourself just to make things light. Okay, and if you do scan the QR code, it should bring you to this Padlet page. So Padlet is a platform where students can leave their comments at their own time. And if this is what I'll do if I want to leave a comment, and hit the enter button. So as you can see, we have the first activity, second, and the third. And last but not least, we have resources, which we will use later on in the lecture. All right. And let's get back to our lecture proper. So if you need more time, you can feel free to pause this video at any point to review the materials or to get to do the activities. Our learning objectives, these are key. So for anxiety and cooperation management, why is it important that we do it? Secondly, what are the underlying principles? How do we execute this anxiety and cooperation management? Last but not least, let's know a little more about a few basic techniques that you can use as dental students or oral health therapy students. First, importance of anxiety and cooperation management. When we talk about anxiety, people like you and me would think that somebody who is anxious would avoid dental treatment. They may make a lot of noise. They may not want to take the injection and things like that. And at the end of the day, it's just a dentistry that's compromised. However, in special care dentistry, where patients are medically compromised, they face a different situation. And I call this compounded anxiety. So what does it entail? So it's anxiety plus medical issues. So if you have ischemic heart disease, you have various triggered conditions, anxiety triggered conditions like asthma, seizures, hypoglycemia, adrenal crisis. You have involuntary movement, dyskinesias that is further potentiated by anxiety. You have people who have intellectual disabilities who cannot rationalize their fear that well, and they may act out, or also people with mental health issues that anxiety can trigger worse of issues. So it's anxiety plus a series of medical conditions that will worsen the consequence of anxiety. So one thing for me that makes anxiety management really important is that we would want to avoid any medical and adverse events here. So this is different from your usual patients. So special care patients can have more drastic events because of anxiety. We would like to improve the quality of dentistry. So if somebody couldn't cooperate that well or moves around, and you will lose that ability to moisture control. If the patient is anxious, of course, they will not like it. They may not come back. They may complain and tell their friends. Okay, last but not least, we like to be predictable in our dentistry. So if we book the appointment to do, let's say, 1 filling or 2 fillings, and at the end of the appointment, because of cooperation, because of anxiety, we can't do it, then that's not so nice, right? So these are the important points of anxiety and cooperation management. The second learning objective is to understand the underlying principles of anxiety and cooperation management. So let's drop back to our Padlet activity. Let's share an incident where you had difficulties with anxiety and cooperation. It could be your student patient or a personal experience back in before you entered dental or OHT school. And if you look into Padlet, I would have already placed in the comment. This is one of my earlier patients, a young 3-year-old patient when I was a dental student. Okay, what happened to this patient? We were doing a filling on 6/1, and because of the sudden anxiety and struggling, the filling stuck together to the adjacent filling, and both filling had to come out. So we were actually a step back, and the parents weren't too happy. So that was a consequence. Okay. So when we have an idea of what difficulties we face, then we'll start to understand what we can do to specifically address the patient's needs. So this is taken from the IACSD, the Intercollegiate Advisory Committee for Sedation in Dentistry. So this was a position paper written in 2015. You can scan this QR code to access this document. Otherwise, you can get back onto Padlet and you can access this at the resource section. So it talks about 4 parts of managing cooperation and anxiety. So it includes behavioral management, behavioral therapy, sedation, and general anesthesia. And if you break it down, there's a little more to it. Behavioral management includes our communication techniques like tell, show, do, stop signals, modeling. Behavioral therapy includes a more extensive way to improve and treat the behavior. So it would probably take more time, a few sessions, especially talking to the psychologist, or sometimes taking medications. And at the end of the day, the anxiety level of the patient is being reduced, and it will improve the person as a whole. For sedation, which we'll be talking about a little more later, there are different types of sedation that dentists can do. It includes inhalation sedation, oral sedation, intravenous sedation, and various other types. Okay, these are the 3 main ones. And general anesthesia. So this is what we'll seek the support of our anesthesia friends, colleagues, and they will sedate or anesthetize the patient. And this can be a day surgery setting where the patient comes in the morning and goes off late in the afternoon, or it can be an inpatient surgery where the patient stays overnight. So sometimes for special needs patients, they will have to stay overnight to monitor because of medical conditions or difficulty in cooperation. So there are also various considerations when we choose between doing general anesthesia or sedation, which takes only a few hours. Last but not least, you have supportive techniques like acupuncture, transcutaneous electrical nerve stimulation. You use scent, music, aromatherapy to improve anxiety, improve cooperation. Okay, so these are various techniques that you can use. So the underlying principle, even before we use the technique, we have to assess the patient. We have to know why the patient needs this. Then we have to plan a treatment around it. Last but not least, that's when the techniques that we have mentioned about will come into place. So let's talk about assessing the patient first. We have to ask a detailed history. Did they have any dental issues? Did they have they undergone local anesthesia for previous dental treatment, or have they not had any dental treatment? If they have not had any dental treatment, sometimes I would stand one side and observe how they interact. For example, a patient that do not cooperate in your dental practice, could it be he or she being afraid of your dentistry, or is it just the environment? And we can seek to test this patient by moving to different locations. For example, sitting on a normal chair rather than the dental chair. Could the patient follow that instruction instead? So if he or she can, that means that he has certain phobia on sitting on the dental chair, and you can assess the patient's, the basis of the patient's anxiety and cooperation needs. All right, so that's assessing the patient. Okay, this takes a bit of time and skill to develop it, but personally, I find that we need to assess the patient in terms of behavior, because this is seldom taught in most dental curriculums, right? Second stage, you have to do some planning, support, and prepare. Okay, I shall explain this slightly more later on. And last but not least, we execute the techniques. And most of the time, and hopefully it will be successful, where we get the dental treatment done. If not, if it fails, we have to go back to basics and assess the patient again. And sometimes this cycle can continue on and on until you find the right way to do it. It may take more than one session, but as long as we keep going, as long as we persevere, usually we'll find one or two ways that will work for that patient. Okay, so this is one patient that I've seen at home care. Really difficult for doing even a check. However, when we left him alone and I observed, he was actually okay sitting on a chair, and later on I realized that he doesn't really know what we are trying to do when we put the mirror onto his mouth because there's like no food, and it's the mirror is definitely not something edible. So this could have caused some confusion and hence the cooperation issue. So we need to assess this. The third, testing. So I like to test my special needs patients by doing a bit of brushing. So if they tend to let me do a brushing, I can step up from this to do a polishing. And if they do accept a polishing, I can use the slow speed handpiece to do simple fillings. And as we progress, high speed handpiece and on and on. So usually the testing stage to me, it's quite an important way to really learn. Especially if the patients haven't had any behavioral assessment by occupational therapists or psychologists. Right, the next stage, planning. Okay, where the first step of planning is to consult the family members, and for students, you will probably have to consult your supervisor or your consultant or professor. Okay, seeking support. So for this patient, his primary language is Bahasa Melayu. So I don't really speak it very well. So I got one of my colleagues who is a nurse to try to communicate with this special needs patient. Sometimes you need more than one dental assistant, as you can see over here. multiple assistants and also family members trying to coax the patient to accept some simple treatment. Last but not least, preparation. So the difference between support and preparation is support has to do more with human resource. That means maybe you need to get an additional doctor to assess the patient, while for preparation, it has to do more with logistics, having the emergency preparedness, like airway devices, oxygen tanks, blood pressure machine. And if you're doing home care or domiciliary care, then you have to pack everything, all right? And the last step of the underlying principles to execute. Okay, with all the techniques mentioned, it's seldom that you need only one single technique to make your magic work. So for this patient, I used non-pharmacological techniques, which included graded exposure, positive reinforcements, and also pharmacological procedures like oral sedation and local anesthesia. So the treatment for this is more simple. It's for assessment and brushing and simple cleaning. While for when I need extractions or deep cleaning, I'll use pharmacological methods. So it can vary for the same patient. And let's go into more details of the basic techniques. So basic techniques includes both non-pharmacological and pharmacological. And let's get back to this table. Your behavioral management and behavioral therapy, and also your supportive techniques are considered non-pharmacological, while sedation and general anesthesia are considered pharmacological. And if we look deeper into sedation, there's a range and spectrum that you can do sedation. So on the least sedated end, you have minimal sedation. It's often thought the same as inhalation sedation with nitrous oxide. But inhalation sedation can also include other forms of inhalable gas like sevoflurane. Okay, so when you describe sedation, it would be helpful to specify the types of drug you use, the depth, like minimal sedation, and the route, so inhalation. Okay, so three things: the depth, the drug, and the delivery route, the 3Ds. The second one is conscious sedation, where the patient, although sedated, will be conscious and you can still talk to them, although they'll be really, really drowsy. For deep sedation over here, that's when the patient loses verbal contact. And for general anesthesia, their brain waves slow down even more to reach an even deeper state of sedation. Okay, the exact definition of conscious sedation is here. It is a technique which the use of drug or drugs produces a state of depression of which the nervous system, of which the central nervous system and enabling treatment to be carried out, but during which verbal contact, that's very important, verbal contact is maintained throughout the period of sedation. So you can access this definition also in the resource section of the Padlet. Can you identify the different types of pharmacological techniques here? So if you like to, you can pause the video and look at each picture. All right, so the first one, it's intravenous. So you create a cannula, you create access to the person's veins with a cannula, and you can inject various drugs into it. The second picture talks about general anesthesia, where you use a range of different medications to deliver to the patient. So it's a cocktail. You can do intranasal sedation. So you have a high concentration of a certain drug and you squeeze it up the nose. The blood vessels in the nose will absorb it and pass it to the rest of your body, and it helps to get you sedated really quickly. So you can use midazolam, you can use ketamine, dexmedetomidine for this. What I've used for some of the patients in the pictures is oral sedation. So midazolam, is the drug I use. Sometimes I use a single tablet, which is 15 milligrams, or sometimes it can be 2 tablets or 1.5. In this, the last picture here, that's me receiving the laughing gas, nitrous oxide, okay? And it's quite a light sedation, and it's one of the safest ways to sedate a patient. What can you use conscious sedation for? There are many indications. Cooperation issues or anxiety issues, and you can have specific issues that patients face, like hyperactive gag. For example, this patient here, we are doing a master impression. I realized that she has quite a bad gag during the primary impression of making a denture. So we just popped on nitrous oxide for less than 10 minutes, and we got the impressions done really nicely with her controlling the gag reflex. So sedation doesn't have to be a very long procedure. And of course, you have long, stressful procedures, sometimes like wisdom tooth. Although the patient can take fillings, cleaning without any sedation, sometimes they would prefer to have some pharmacological methods to bring down their anxiety and improve the experience of dentistry. Having talked about a range of different pharmacological methods, let's talk about non-pharmacological methods. I'll be introducing just one, the graded exposure. So the graded exposure is used to tackle avoidance to a situation, an activity, or an object due to anxiety. How does it work? So it works by breaking down the goal into a hierarchy of steps. When we progress through the steps, we have to impart relaxation techniques. So as we progress through the steps, the patient or the client must have controlled or managed their anxiety before progressing. So let's say, this is often used in clinical psychology. Let's say the patient is really fearful of lizards. So you can start off by breaking it into steps. You break it into steps. The first step is to even think of a lizard. So if the patient or the client cannot even think of that, you cannot progress to further steps. So the second thing is you could see a lizard far away. Okay, so that's the second step. The third one is you could bring it closer in a container, and you can progress up from that to maybe get a lizard toy for the patient. If the patient can't even touch the lizard toy, you won't think that the patient can reach the last stage where the patient will really be okay with being in close contact with such an object. Okay, so as you progress each step, you get the patient to, for example, do progressive relaxation. Take a deep breath in, breathe out. So practice various relaxation techniques. In dentistry, something we do often is we use positive reinforcement. So if the client or patient reaches that step, you say, great job. It seems that you have gotten much more confident about this, and the patient feels good. So that's another way to help to relax the patient. So you can use this to mix and match. And if you think about it, the very traditional behavioral methods that we are all taught for pediatric dentistry, in the pediatric dentistry module, is tell, show, do. It seems like a very simple method, but you can actually bring this to a very high level. So telling it's to let the patient conceive that idea of, let's say, doing a polishing, and then you show it. You can do it on your hand, you can run the instrument, and then you can place it slightly on the patient's hand. Okay, so that's show. So as you can see for show, the part about show, is a longer spectrum. You can break it down into further steps. Last but not least, to do the procedure. And if it fails, you may have to go back during this loop to try to improve and see what are we missing out. So let's bring in a little example here. And I hope it gives all of you more inspiration to think about how to further strengthen this tell, show, do technique. Because when I teach my students, I see that they do know this technique verbally, but they are not able to bring it to a higher level. So in this case, it's a home care patient. So Mr. X, he's 95 kg. he has not been able to get out of his house for decades. And the last time when they moved house, they had to use 7 security guards to really bring him over, and he's not able to see dentists outside, and hence his oral hygiene is really, really poor. And he has not really seen a dentist. So by being somebody who is intellectually disabled, by telling them something, they may not conceive it directly. So I'd like to further communicate this through using various tools. I'm just going to teach him brushing today, very simple. So that's the first thing that we should always teach. And over here, I'm showing him the toothbrushing model. I took out the toothbrush and passed it to him. He looks at it like an object, like a spoon or something. Okay. Second, of course, I show him how I put up the gown, and it's nothing too intrusive, my apron and my gloves. Then I show him the toothbrushing. He's a bit interested here, but he's also slightly more anxious. I went ahead to try to get some brushing done. However, as you can see, he's moving away, and we needed a few people to try to get him to stabilize. Okay, so there's a change of plan. How do we further relax him before we progress to the next step? So remember, graded exposure. After we break things up into steps, the second important point is for relaxation. So we placed him onto a sofa. So he's really nice there. We put the brush onto his hand, and I get him to brush the toothbrushing model. And after that, we were able to get him to brush really well with my hands, and he just opened his mouth and let me brush. So we were able to achieve that relaxation and progression in the technique. So our graded exposure, or tell, show, do, was a success. Okay, and with that, I hope all of you learned something helpful today. Last activity, managing cooperation and communication. So with what you have learned today, and with the situation you have used in activity 2, can you think of some ways that you can improve that situation? So please leave your comments in the Padlet, and I'll check back. And with that, you can, hopefully over time, you can look at all the different comments that various dental students, various OHT students around the world contribute, and you can learn from that platform as we go along, and as more and more people go through this. Okay, thank you all for your time. That's the end. My name is David, and I'm signing off here. Have a good day ahead.
David, that was really excellent. So thank you so much for that lecture. That was really helpful. I found your work with silver-dynamine fluoride and in domiciliary care really insightful. I'll just hand over to Professor Durward. Callum, is there any questions or comments you would like to make?
Yes, thank you very much, David. Do you think that special needs patients are often anxious about treatment? And why do you think that is?
Well, in my experience, many of the special needs patients that I see have not received dentistry for most parts of their life. And when they do go to the dentist, it's usually when there's pain, discomfort, and then they will require extensive treatment. So with that, think about it in their shoes. When you enter the dental practice, you face so much difficulties. Of course, you'll be experiencing significant anxiety. So as we go around working with our group of patients, so we need to be aware of this point that they are most likely going to be more anxious than the usual patients, particularly patients that come on a regular basis for preventive treatment.
Thank you, Dave.